Today I'm going to present you a very important nutritional deficiency disorder which beautifully connects the biochemistry with the clinical medicine, which is nothing but this is the vitamin C deficiency, that is scurvy. Let's going for the next slide. Okay, let's think about what is vitamin C. Vitamin C is not synthesized in our body, so that's why we are going to take the vitamin C from our diet. Okay. Let's first we will talk about the crucial role of vitamin C in our body. Let's go to first slide is helping collagen synthesis. What is collagen? Collagen is present in connective tissues like in cartilage, in bones, in blood vessels, in skin. Okay. So first I would like to explain you that the vital crucial role in the collagen production or synthesis. That what if we don't have a vitamin C, then what is the problem in the collagen synthesis? There will be no any collagen synthesis. I will going to introduce about. So guys, I am going to telling you how the collagen synthesis occurs in our body. Let's suppose we have a two amino acid, proline and lysine. Let's see. This is tropocollagen. This is proline. And this is lysine. In first of all, we have a tropocollagen, which is not in active form, and then from the tropocollagen, we're going to just collagen producing the procollagen. And to produce the procollagen, we need the vitamin C. And this process is called the hydroxylation. It means the OH group will attach with the proline and lysine, and finally it will make the hydroxyproline and hydroxylysine. Let's see about the hydroxylation. Color change. This OH group attached with this. Okay?
It's proline and lysine.
This is hydroxylation process, and the while hydroxylation process, we need the vitamin C. Vitamin C. And let's think about this. When there is no vitamin C in our body, we are not going to take more vitamin C in this food or vegetables. We are not going to eat the leafy vegetables like spinach, okay, like cabbage, like cauliflower, and you are not going to eat more like we have a carrot, okay. Then might will suffer from the scurvy. Why? Because there will be no any production of the hydroxyproline and hydroxylysine. And now moving forward to the glycosylation process.
Vitamin C work as a coenzyme?
No, sir.
How they are making hydroxy? They are attaching.
They help in hydroxylation process.
Only.
Yes, vitamin C help in hydroxylation process.
As a catalyst?
As a catalyst, they help as a something which going to enhance the to produce like this the procollagen, and hydroxyproline and hydroxylysine is the active form. And without hydroxyproline and hydroxylysine, there is no going to make the collagen fiber in our body.
Yeah,
that's why vitamin C is important. Like
if vitamin C will be present, then
yeah,
they will not change into the hydroxy.
Yeah, if there is no vitamin C, then we know hydroxylation of proline and lysine.
Okay, then what will happen?
Then I am going to this. Okay, let's see. This is the hydroxylation process, and in hydroxylation process we need vitamin C. And now this is the now it for the form of collagen, right? Collagen. Propocollagen to procollagen. This is the hydroxylation process, and from procollagen to collagen, it is the glycosylation process. Glyco means glucose. Okay, so here the glucose will come and add with the proline, hydroxyproline and hydroxylysine. And now think, if there is no vitamin C, there will be no hydroxylation of proline and lysine. then there will be no glycosylation of the hydroxyproline and hydroxylysine. It means there is no any conversion of propocollagen from propocollagen to procollagen, and there is no conversion of procollagen to collagen. Let's think if in your body there is less collagen or the formation of collagen is not occurring because due to the vitamin C deficiency, it will affect your blood vessel, it will affect your bones, it will affect your cartilage, it will affect your skins, it will affect your tooth fall. There is a falling of the tooth and you become like a Gandhiji 1947. Okay, so let's go for the slide. Okay. So slide.
अब इधर भी ध्यान देना थोड़ा सा
Second slide.
इधर तुम सेकंड कर रहे हो तो यहाँ से मैं क्लिक कर दे रहा हूँ तो फर्स्ट है
Now, scurvy is a disease resulting in a severe and prolonged deficiency of vitamin C or ascorbic acid. It means it not occurs immediately. If you have vitamin C deficiency but from many times, from a long time, then it will be affected about the scurvy. And scurvy is sometimes fatal also. If you're not going to for the treatment of vitamin C, you're not going to take the tablets or capsules of vitamin C, it will be fatal. And as we know that vitamin C is not produced in a human body, so that's why we have to take from the diet. And let's think of sign and symptoms. What is sign of symptoms? That's a fatigue and weakness. One of the earliest and the most common sign often recognized by the general malation. Okay, let's think. First of all, the primary symptoms will be like you become fatigue or weakness. That will be weakness in your body because there is no collagen synthesis, and bleeding in the gums like here. Okay. And there is also patagy and echinoma, small red purple spot in the legs and hand. And after the joint pain, there will be joint pain. Why joint pain? We have learned about hyaline cartilage, fibrocartilage, the elastic cartilage. There's too many types of cartilage. And to make the cartilage, we need the collagen. Right? We need collagen type 2, we need collagen type 4, we need collagen type 1 for the bone formation. If there is no synthesis of the collagen, then there will be no synthesis of the hyaline cartilage, the fibrocartilage. And if there will be no cartilage, hyaline cartilage and hyaluronic acid in the joint, there will be the bony pain in the joint. There will be no anything which is going to reduce the friction or reduce the pressure of the joint. That's why you will find the joint pain and swelling also. Okay, it means it might affect the arthritis, it might affect the osteoarthritis also. Now going to poor wound healing. Vitamin C also help in the coagulation process. If you have vitamin C deficiency, let's suppose if you have bleeding in your hand, if you have bleeding in your leg, there will no any clotting formation. Okay, because you have the vitamin C deficiency from long time. Okay, now see the symptoms. There is a fatigue and depression. There is increased susceptibility of the infection in the lungs, and pale skin and weakness of the muscles, and rough and dry skin, the loss of teeth, and the skin, and the bleeding in the skin and mucosa, because there is no clotting. That's why. Moving to the next slide. Okay, if there is a severe deficiency of vitamin C, it might be affect the anemia, chronic blood loss from the bleeding gums. As I told you in the previous slide, that there is a bleeding of the gums, and that's why if you more bleeding in the gums, it might affect because the anemia, the loss of the RBCs, and humerus can lead to iron deficiency and anemia. Okay. Now jaundice, a very beautiful disease. In severe cases, the breakdown of the red blood cell due to the internal bleeding can cause jaundice. And neuropathy, the peripheral neuropathy affecting the nerve function can manifest a number of tingling extremities. And there is emotional changes also. And at last, if you are not going to treat this scurvy, you will be deaf, or if untreated, if left untreated, the severe scurvy can lead to the organ failure, internal bleeding, and ultimately death. Oh, okay. Where to find the natural sources of the vitamin C? Okay, let's suppose we are going to take the citrus fruit, oranges, lemons, limes, grapefruit, classic, and known as the high vitamin C. And the black peppers also, and the yellow bell like peppers, wild contain more vitamin C, citrus fruit, and in the broccoli and leafy vegetable, and kiwi also. These are the fruits and vegetables from rich in source of vitamin C. Maybe the next slide, sir. Okay. As we know that prevention is better than cure. So for preventing from the scurvy or vitamin VC, let's suppose you suffer from scurvy and it is your initial stage. Then there is some medication, some diagnosis we are going to use. Like in the diagnosis, in the medicine, we have an oral vitamin C supplement. This is the primary method with doses typically ranging from 250 milligram to 1 milligram for the individual, for the adult one. But this doses depend upon the weight and also in the age also. Okay, and the dietary modification incorporating the vitamin C rich food into the daily diet is crucial for the long-term prevention. If you're taking, let's suppose you have to prevent from the this disease, you have to take the more vitamin C sources, vegetables and fruits and everything like all also. Symptoms management, addressing the specific symptoms like pain with the analgesic and providing the dental care for gum issues. Now we have a medicine called sodium ascorbate, a non-acidic vitamin. We take 1000. There is a bottle of 1000 mg. Okay, and we take about 250 mg to 1 gram. Okay, for the adult one. Available at the tablet. These are available as a tablets, as a capsule, as a chewable tablets also. Ascorbic acid is the most common and effective form in the chewable form. Doses for this doses for the treatment is typically 250 gram to 1 gram daily for adult, per day for the adult, divided into doses until the symptoms resolve. It means you are taking the 250 gram or 1 gram, 250 gram to 1 gram, but until your symptoms is not going to resolve. The pediatric doses are also adjusted based on the age and weight, as I told you before. The precaution: high doses can cause the digestive upset. Consult a doctor for appropriate doses and pre-existing condition. While we are more focused on we have to take care about the how much the gram of vitamin C we should have to take, because there is too many medical conditions. Let's suppose you maybe suffer from the stone in the kidney. If you take more vitamin C in your diet, that's why take the less amount of mg, like 250 or 1 gram mg, according to the age and according to the weight. And I would like to tell one also tablet that is Limcy. Limcy, the price of the Limcy in India is maybe 75 rupees for the 10 tablets. Okay, the prevention is a key and maintaining the optimal vitamin C. First, balanced diet, regular intake of the fruit, vegetables rich in vitamin C is the best preventive measure, and the diverse food choices like vary your diet in the ensure a broad spectrum of the nutrients and not just the vitamin C but all vitamins. Okay, multivitamins. Consider this supplement for the individual with the limited dietary intake or increase the needs. Example, smokers, the pregnant woman supplement can be beneficial. If someone is pregnant or someone is smoking, like someone is taking alcohol, they should have to take higher amount of vitamin C tablets or higher amount of vitamin C capsules. Okay, the regular checkup, consult a doctor to assess your nutritional status and take the recommendations. Thank you for your kind attention. That's all for today. Thank you.